The most common way that we detect prostate cancer is through a blood test performed by the primary care family physician or by a urologist to check for what's called PSA, which is a prostate-specific antigen, and it's a molecule that's made by the prostate and it's released into the blood normally, and when it's elevated in the blood, sometimes that does mean that there's a cancer there, and we check further to see whether in fact there is a cancer or whether that cancer is even important or dangerous. Generally speaking, men in their 50s, 55 or older, up to 70, are advised to look into the blood test, research it, discuss it with their family doctor, their urologist, and see whether that test is something they want to do. There are a group of patients who are at higher risk for prostate cancer, and they are men who have a family history of prostate cancer, have an increased risk, and also men of African American or Caribbean descent. In that group of men, we often recommend that they discuss the PSA test at an earlier age, in their 40s, with their family doc or their urologist to see if they want to begin doing that test at a younger age. These days, even when we find that a man has a cancer, oftentimes we don't have to treat it, we can watch it. We have a lot of genetics testings that we do that might help us understand that it's actually not very dangerous cancer. When those genetics tests or the biopsy shows that it is a risk to the patient, if that patient is otherwise healthy and can look toward 10, 20, 30 years of life, then we start to think that that cancer might pose a real risk to them.